I recently tested a woman who was about 7.5 years into her hormonal therapy. She was diagnosed in her late 40s, so 47, something like that. Um, Fairly high risk luminal breast cancer. Um, Under the microscope, it was intermediate grade, and she had a microscopic focus in one lymph node, and her other four lymph nodes were negative. She had a lumpectomy and radiation and 4 months of chemo, and then went on tamoxifen for 5 years. She has three, at the time, she had three teenage children. Uh, and she, again, was risk averse. She didn't want to take any chances, but she was having a lot of problems with the tamoxifen, and then we switched her actually based on the MA17 trial to an aromatase inhibitor, and um, and she's been on an aromatase inhibitor about a year now, and has had a lot of achiness, uh, vaginal atrophy. Her sex life was really as terrible as she puts it, and but yet she kind of powers on. And so we did the test, and she actually came back in the high risk group, showing that the hormonal therapy was very effective in protecting her, and that over the next 5 years, the second 5 years, she had close to a 10% risk of systemic recurrence. So what we've decided to do is put her back on the tamoxifen because she tolerated it much better, and we can allow women to have some vaginal estrogen and some herbal things that really help some of the quality of life issues. She's back on tamoxifen, and she's committed for another 3 years to do this. And I think she feels I think she feels good that she knows she needs this and she's going to do it. And I, as her doctor, feel better now that she is going to be compliant and do it, and that it really potentially can really help her.